Hello there, it's Jennifer McCreath again. Thank you for watching part 1 and part 2. I'm sorry that we had the videotape conk out on us, but we do have the audio tape. So I'm going to press play and once again focus the camera on a screenshot of me, since I'm fairly attractive, or at least I was back when that picture was taken. Here's part 3 of my speech that I delivered on March 31st. I hope you enjoy. Bear with me again. I'm going to get the thing fired up here. Whoa. That's rather noisy, but sorry about that. Here we go.
You probably better find another way to come up with the money you need for this surgery. It leads into, I guess, another important issue, which you don't hear a lot about, is the concept of employment discrimination in the LGBT community, specifically the T community. Exactly 1 year ago today, I lost what was a very good job, which was allegedly a safe and secure job with the provincial government. I was a senior policy analyst with the provincial government in the office, the chief information officer. Shortly after coming out as trans, plans, interestingly enough, changed. There were some corporate reorgs that went on, and all of a sudden my position was no longer necessary. Thank you, Jennifer. You did a great job. We'll give you great job references, but goodbye. Okay. Was there really a corporate reorg? Well, there's someone else that was brought in and is doing probably 99% of the work I was doing, and this new person's not trans, so I think I can figure that one out. I think everyone else can. Do I want to go and fight that? That's a whole other topic that I could go on and on about, and maybe will publicly one of these days. But getting back to health, it's critically even more important that trans people have access to public health care system that works for them, because unlike Premier Williams, I can't just whip out the wallet and fly down to Florida every time I need to have some sort of medical procedure. And so meanwhile, I sit here and I'm not getting the care that I need. Okay, where do we go from here, and what can we do? The Human Rights Commission. We talked about that a little earlier. The words gender identity and gender expression do not appear anywhere in the Newfoundland Human Rights Code. The word sex and sexual orientation does. I've been strongly advocating that we add those two words because they are different. This isn't an issue about me being legally male or female. It's an issue of gender identity and gender expression, and that's why there's issues with the healthcare system. I could take legal action. I could go to court. I've been advised that I could win. It takes a lot, as others have in Ontario and elsewhere. But lawyers cost money, and it's time-consuming. Even with the Human Rights Code being the way that it is, I have gone. This is, I guess, my first public announcement. I have filed a human rights complaint. I did so back about 4 or 5 months ago against our provincial government's Department of Health and MCP, citing discrimination. We've got health is legislated at the federal level regarding, I guess, the principles of the Canada Health Act, and the provinces have been left to implement them. And my argument is there's clear discrimination on the basis of gender identity and gender expression, that I'm not getting the care that I need, that my doctor's recommendations are being ignored, and that they are adding additional unnecessary impediments to my ability to gain the products and services that I need. Who knows how long this is going to take? Bottom line, I need care now. I can't wait for human rights. And locally, it's been brought to my attention that Eastern Health has created a what I refer to as a private and secret transgendered persons working group. And they've done up a little report that's, I guess, been in the works over the past couple of years. And I've been approached by people either on the committee or associated with the committee. Who said, here's the next steps we want to take with trans health. Jennifer, I guess basically what they want to do is beef up with resources in Newfoundland with regards to counseling, psychology services. And they wanted my help with some names. And so I gave them some ideas. But at the same time, I said, by the way, there's other issues here that you guys aren't touching here. It's one thing to help transgender people, but the transsexual issue is the surgery. You can't cure a birth defect by counseling. You need surgery. Why is this not being looked at? Why have you not engaged the trans community? They're going into a boardroom, closing doors, making up their mind about what they think, what healthcare they think people like me needs. They are closed-minded, unreceptive to my feedback. I was told my feedback was not wanted or needed. I was told we don't need you lecturing at us, Jennifer. I even lost a Facebook friend over this, amazingly enough. these are people that are loved and respected in the LGBT community. That's the whole other issue for me, is the clash between the LGBs versus the Ts. And bottom line, one other quick issue there. These folks want to push the Vancouver Health hormone protocol, which is good in some ways. It's not perfect. It's not the best one for trans women. One particular hormone that has been cited as important for breast development in trans women is progesterone. Vancouver Health, for reasons they won't share, does not recommend progesterone. Bottom line is, if I don't get progesterone, I'm not going to grow breasts. You don't see breasts here. This is 2 years of estrogen. Now, it does take time, but progesterone will help with that. I can't get that here because nobody's willing to prescribe it or advise that it be prescribed. Again, I could go to the United States. It's quite common. I could whip out the credit card, fly to Boston once every 3 months and get progesterone from a private doctor there. I can't afford to do that. So that's one issue. But the biggest issue is we need to stop this CAMH monopoly. We need to stop sending people to CAMH for assessment. We need MCP and our provincial government to write policies, to revise policies. Every trans person is different. It's nice to be able to put health in a box and say, this is how you treat people, this is how you treat those people. Every trans person is going to be different. We're going to have different needs. You got to give the doctors the power to make the decisions. My doctors have worked with me for 2 years. They know what I need better than anyone else in a boardroom or anywhere else. So I invite anyone and everyone to open up your boardrooms, open up your documents, meet with me. There's other trans people in this community that are visible. There are many who are not. Find avenues to reach all of us and work with us so that we get the care that we need. Because ultimately, if we're not going to be invited into the boardrooms, we will take steps to see you in the courtrooms, and we will win. That's basically what I have to say for now. So thanks for listening.